Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. I am so excited today to have my fellow arthritis friend and friend in having the same name as a celebrity, Carrie Bradshaw. Welcome.
Hey, Cheryl Crow, how are you?
I'm good. How are you?
I'm doing great.
Yeah, we met in September 2024 at the Health eVoices conference. And that was an amazing experience. But first of all, can you just let the listeners know, where do you live and what is your relationship to arthritis, or what kind of arthritis do you have?
Sure. I live in Houston, Texas. I'm a mom with two kids. I have an interesting story. I don't have rheumatoid arthritis. I had osteoarthritis in my hips. I was diagnosed at the age of 40 with something called congenital bilateral hip dysplasia, which I never knew I had. And it's the leading cause of early osteoarthritis in young adults. So after that diagnosis, I was in a lot of pain. I had to undergo two hip replacements the following year. So I am now a bionic woman.
Yeah. I mean, and I would, this is something we have not covered on the podcast so far. There have been a couple of people who've had joint replacements, but none from my memory, which my memory is faulty sometimes, but with, from hip dysplasia and resulting osteoarthritis. Can you tell me a little bit about what led you to get that diagnosis? Like, what were you feeling? What were you doing before that? Because you were pretty active, right? You were running
Right.
and yeah.
Yeah. So my whole life, I played sports. I know, like you, we both played soccer. I played through high school. I'm a marathon runner. I'd run Boston Marathon in 2000, the Boston Marathon in 2015. I'd run 10 marathons, probably 50 or 60 half marathons. It's a huge passion. And basically, yeah, like in my late 30s and around 40, I was starting to experience hip pain, mainly in my left hip. And I kind of thought it was normal at first, but it got progressively worse to the point where my leg literally locked up on a run one morning and I couldn't walk home. Yeah, and
Oh.
I was still like, okay, I thought maybe something was broken.
Mm.
So fast forward, I went and saw a specialist, and they took some imaging and said, Carrie, did you know you have something called hip dysplasia? And I was like, what is that? I don't know what hip dysplasia is. And they basically, so what hip dysplasia is, I was born with it, congenital hip dysplasia. I want to say I read a statistic, 1 in 1,000 babies are diagnosed with it. A lot of times it goes missed, like in my case. And your hips don't form correctly. So my hips never form correctly. The sockets are too shallow for the hip. And what happens then over time, their hips, I guess, grind all over each other and it causes arthritis. And so by the time I went into surgery, it was already bone on bone. They said it was nasty. I have pictures. But yeah, it caused a lot of pain and arthritis, and
Uh,
it was basically a big curveball in my life.
I mean, I can't imagine. So all those marathons, the majority of them you ran before, and the half marathons before your diagnosis, right? Yeah, that's
Before kids. So yeah, I
before
had my
kids.
first son in 2016, and I ran the Boston Marathon in April 2015, and then another marathon in May, and then got pregnant with Theo. And I did run during my pregnancy with Theo, and I would have hip pain that was really bad. But I was told it was probably because we didn't know I had this
Yeah,
issue. It was we were told, it was probably around ligament pain. So I would limp
yeah,
around. I think it was basically, I think the arthritis was starting. So I
yeah,
continued to run even after pregnancy, but it was starting, the hip pain was starting, and it was just progressively getting worse over the next few years, to the point where I couldn't run, or I couldn't even
yeah.
basically walk around like the block.
And then what year did you get your diagnosis?
It was 2021.
2001. Wow. Okay.
I was 40 years old. It was I
That's
remember it
right.
was right after school started. It was the morning that when my hip locked up, and then I went to the doctor, got into a really good doctor a couple months later.
Wow.
It
And
started to.
just a little educational tidbit, because I know a little bit about hip dysplasia or congenital hip dysplasia as an occupational therapist. And also Charlie, my son, was a breech baby. And what they
Right,
do with all breech babies are screened for hip dysplasia, because his head wasn't down in the pelvis, his head was up high, and then his butt and hips were in my
right,
pelvis. I mean, so his legs were stuck up a little bit at first when he was first born, and that's really common for breech babies. But then they screen
right,
them right after birth, and then again, like at I forget how many months, to make sure. And you can correct for it if you catch it early. But if you did, in your case,
right,
over time, it had so many years to evolve. And it's kind of
right,
incredible that you were able to do so many marathons and run so much before it was causing problems, you know?
right. Well, looking back, actually, and I talked to I saw several doctors. I did have pain. I had a lot of lower back pain
Uh,
growing up, and I didn't, and hit some, like glute and back pain, and I didn't realize this at the time, but it was probably linked to the hips being deformed, basically, and my back was having to compensate. I had severe lower back pain, and I would, like, yeah,
wow.
I would get like tight hips and SI. And so I don't know, it went on for years, but I just kind of thought that was normal, par for the course, for running. But yeah, that wasn't until my actual hip locked up that I realized this is in my hip. Something's up with my hip, not my back.
So fascinating. Yeah, and I
Yeah.
remember this is one of these funny memes I've seen online, but it really relates, where someone's like, "How much pain are you in?" Like a guy, I don't know, like a guy in his 30s asks his friend, "How much pain are you in right now?" And he goes, "Oh, the usual amount." And then the other friend's like, "The usual amount is zero." And they're like, "Oh." Like so many of us who have pain, you
Right.
used to it. You think that's just normal.
Right,
Yeah.
right. And Ben, my husband, I mean, I don't remember how he phrases it exactly, but he said, he was telling somebody, yeah, I remember this was like 10 years ago. Carrie would just, like, in the middle of the night, I'd wake up and I'd be like doing these like weird, crazy stretches off the bed to like get
My
some sort
God.
of relief in my back and hips. Like
Oh,
my legs would be contorted in different directions. Like it was like, it would bother me. Um, just, I needed a lot of deep massages and like super deep pressure, and yeah, I don't know, it was obviously, manifesting or presenting itself early on, but it wasn't until 2021 where everything came crashing down, basically.
I'm so sorry. How did you feel when you got that diagnosis?
Well, at first I was kind of in denial. They told me that they thought at first they didn't see the osteoarthritis yet on the imaging. They missed it.
Oh,
So and I didn't know what dysplasia was. And they're like, a lot of people have a torn labrum and dysplasia. So if we put you in PT, there's, surgery. I'm kind of glad looking back that I didn't know the extent of how bad it was going to be right away. It happened eventually, but they told me to try PT and maybe I'd be able to, it would get better, but it wasn't getting better with months of PT. I was still in severe pain. They couldn't figure out what was wrong because the MRI, the angle of the MRI for some reason didn't show the extent of the arthritis. So they had a bunch of
interesting.
surgeons all looking and doctors all looking at my imaging, being like, what is going on with Carrie? Because she is still having, like, felt like my bones were broken in my left leg. And so they sent me to another specialist, who specializes with hip dysplasia. And I went around to a few more specialists, did my research, interviewed several doctors, and finally, found the one that I eventually went with, Dr. Stocks. But so initially, back to your question, when they told me, I had hope. I was in denial. I had hope that with PT that I wasn't going to need any surgery. It's not that big of a deal. A lot of people have, this and don't have any problems. I didn't realize what I was really in for. And maybe the universe and God were protecting me because it was just my way to start processing it all.
That's super common, like just denial or kind of, optimism, a form of optimism, right? Being like,
Right.
okay, well, we're going to figure it out. And okay, I'm validated that there is something wrong. This isn't just me running too much. Like,
yes. A funny thing, it's not funny, but one interesting thing is one of the surgeons I saw told me that he said, Carrie, most people would have been in the ER 10 years ago with your pain. And I'm sure you can relate with your arthritis pain. And he said, once they realized what was going on, he's like, most people would have been in here 10 years ago. But, we're so used to just putting up with it and thinking it's somewhat normal until like something literally breaks or it's so bad where you can't ignore it anymore. So yeah, he thought too, the reason why it didn't come on sooner, because I was an athlete, I had built up the muscles and the strength around my hips and my back and my glutes. So that was able to sort of protect them and maybe kind of buy me a little bit of time before, everything that, straw that broke the camel's back that day when everything, I couldn't walk and everything came crashing down. But yeah, he said a lot of people probably would have been in there 10 years ago.
Yeah. In a way, it's like a testament to the positive impact of exercise to some degree that, people with arthritis are often tired of hearing how important exercise is. It's really important for osteoarthritis and inflammatory arthritis, like, study after study after study. And when I say inflammatory arthritis, that's like the autoimmune kinds, like rheumatoid, psoriatic, ankylosing spondylitis. And I think in your case, I would imagine that if you hadn't exercised so much that you may have been presenting into the doctors earlier with a lot more pain, but we'll never know.
Right. Well, it's funny too. I keep saying funny, but one thing that's frustrating, and I know you've talked about it before with your diagnosis of arthritis with other guests, is when I found out, once I found out that I was going to need my hips replaced, and was on that path, so many people, a handful of people would just say, "Oh, it's from your running. You have this from your running." And I'm like, no, it's actually because I was born with this condition. And I couldn't get into it with them. They want to believe what they want to believe, but they were quick to they said, blame it on my running. When really, I think a lot of times in this case, that actually helped protect my body and my hips and, let me make it to age 40.
Yeah. Running does not cause someone to need double hip replacements from osteoarthritis at age 40. There's no evidence that, but I think it has to do with this phenomenon that many other guests have also shared, where people in your life, they want the world to make sense. We all want the world to make sense, right? Like even I share this example, my mom has given me permission to share this, that, she said a few times, oh, I know, or kind of, you might have gotten rheumatoid arthritis because I drank Diet Coke when I was pregnant, because we didn't know back then that diet soda, I don't even know if that's true, that diet soda is bad, but for pregnancy, but you want there to be a reason, right? And or maybe it was if I had just gone vegan or something, I wouldn't have it. But at the end of the day, health conditions, they sometimes have no reason, they just happen. And in your case, or it's a reason that you had absolutely zero control over, that you had hip dysplasia, you were born with it. You didn't like fail at trying hard enough not to have it.
Right. And I tried everything I could to try to make it go away. I kept believing there was some miracle. I did something called PRP, which is a process where they take your blood and spin it all around in like a centrifuge, and then inject it back into your hip or whatever area on your body needs it to help sort of restore the cartilage damage or help. And it did buy me a month or two. I did it twice. It's really expensive, painful, but I was just trying everything I could before I actually went the surgery route. And also a lot of doctors, it's kind of controversial that I'm running again, which we'll get to a lot. That's a huge part of my life and my, that I didn't know if I went under these surgeries, if I would ever be able to run again, which is my passion.
Yeah,
And a
yeah.
lot of doctors said, absolutely not, like it's over. So I had one surgeon
Wow.
tell me, after interviewing several, like, Carrie, I is assuming everything goes well with your recovery, I have no problem with you trying to run again. He said he had seen
Wow.
such great results, and the new technology for the prosthetic joints is so good that he feels confident. And it just obviously depending on, he's not making me any promises, but he wasn't shutting that door for me. And it
Mm-hmm.
gave me that hope, because backing up a little bit, when I was going through this like year process, trying to do everything I could to avoid surgery, hoping there would be a miracle, I was like, also, I felt like I was in, like, no matter what I did, I was in a crappy situation. It's like I'm in pain, trying to manage all of it and go through
Yeah.
all of this stuff, or I do the surgery and I still can't run, and I'm in a lot of pain for the recovery.
Yeah. Yeah.
So it was just like it was just like a lose-lose situation. But yeah, luckily I found my miracle doctor who was able to back it all up with research, and he was the one who gave me hope. And
That's
and
incredible.
here I am. Yeah.
That I know, and I want to get more into that for sure. First, I do want to talk a little bit about what it was like to get double hip replacements at age 40. Because I remember when we were talking at the conference or the
Yeah.
event, you were saying how, it was there was, I mean, anything you want to share about it is great, but also the specifically what it was like to kind of look through the pamphlets and try to find stories like wanting to
Oh.
know if someone else had been through it, and every story you could find was people who were like in their 70s, which,
Oh
not to be
yeah.
ageist, it's just representation matters, right? Like you wanted to
Right.
know. Yeah, tell us
Right.
about that. If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thrive room with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
So that was another thing. I couldn't find anybody like me. So I'd be up at night with, as you guys probably know, with arthritis pain, it would wake me up. I would have a hard time sleeping, and I was just depressed and anxious. And I would be like searching for somebody like me to be like, all right, is there somebody, an athlete who's young, who can go back to doing what they love to do, whatever sport that is, or running for me, long distance running. And I couldn't find anybody. All I saw was like, just normal everyday people, mostly in their 60s, 70s, and 80s. And so when I went in for my pre-op, so when I decided to go through with this, that's a whole other story. But when I finally was ready and was like, I'm doing this. It was a week before, which I'll get into the story about that, what made me decide to go do it. I had to go in for pre-op and at the hospital. And it's kind of funny. I just remember being in there and there were all these like 80-year-olds and me with the joint replacement in the joint replacement area at the orthopedic hospital. And, they were, I felt like so out of place, right? Like here I am with the marathon, trying to go back to running marathons. And they're like, what are your goals? What are your goals? We had to talk about what our goals are with the surgery. And, they're like, do you want to go back and play with your grandkids? Do you want to get on the floor and do you want to garden? And I'm like, I want to go back and run the Boston Marathon. Is that possible? And I just didn't know. So going into the surgery, I didn't have somebody, that I could look at and be like, okay, they did it. Like that. Everything was uncertain. And that was one of the, scariest parts about going through with this surgery is I didn't know the surgery in itself scared me. The pain, the recovery, just getting your leg basically chopped off in a construction zone, all of that scared me. But then I didn't know if I was even going to be able to do what I love still.
Wow. That is so, so heavy. And so it's no wonder that, that it was a huge decision whether to
Right.
have a surgery at all. So you said that you want to, what are some of the things that you were going back and forth on when you were deciding about surgery?
Well, I interviewed a lot of surgeons. That's my main piece of advice. We can talk about at the end, but I interviewed Houston has the med center. We have a lot of great doctors and surgeons here. So I'm really fortunate for that. So I did a lot of research. I even talked to one out of state, especially ones that work with athletes, and met with a lot of surgeons, did my own research. And when I finally met my doctor and asked him, I expected him to say no about the running. I was just like, I had that, I got like a little piece of hope. Like, are you serious? Like, and then I wanted him to explain, like, why are you saying I can do this, but other doctors are saying I can? And he was able to explain it. Anyway, he, at my appointment, so this happened all over about a year. At that appointment, I kept trying PRP, and he was like, why don't we just put a surgery on the books for this fall? I book up really fast. Let's just get something booked. I put it down for November. I met with his assistant, and he was like, I didn't think I was really going to go through with it. So he's like, just get it on the calendar. And if you don't want to do it when the time comes, don't. But I book up, and if you decide you're ready, then we can do it. No pressure. So did I really think I was going to do it in November? No, it was November 22. This was back in June or July. So fast forward, it was Halloween. Halloween night, so about a week, I was scheduled for November 7th. It just happened like a week ago. And I was scheduled for November 7th. So on Halloween, October 31st, I was trick-or-treating with my 2 kids and my husband, and I couldn't walk around the block. My leg was in so much pain, my hip. So I tried, and I limped around for probably 10 or 15 minutes. And then I was like, I can't do it. I have to go home. I was in a skeleton outfit. That ironically, and I had to leave my family and go home. And that was the moment of clarity that I needed, as depressing as it was and as painful as it was. That was my moment where I was like, all right, I'm doing it in a week. I'm gonna have the surgery. I can't even trick or treat with my family. Forget the running. I can't even trick or treat or walk down the block with my kids, go to the park, whatever it is. Like, what am I doing? This is the answer I need. I needed an answer. I felt like it was my sign from God. So with a week, I was like, all right, I guess it's on. So a week later, I had my.
And your kids were 4 and 6, right?
At that time, yep, they were 4 and 6,
Yeah,
first grade and pre-K.
So I mean,
No, sorry, yeah, first grade and pre-K.
That's just a lot to have to be handling on top of being a mom. And,
Right.
I think that's just, I mean, what can you say? It's just a lot. It's not a simple decision, you know?
Right, right. And then just having to, they didn't really understand, especially my youngest. So we don't have any family here either. My mom flew down for 1 week when I had to use a walker. But my oldest cried when he saw me. Like, he didn't know what to expect, and he sees his mom, who seems quote unquote normal, like nothing's wrong, and then he goes to seeing me limping, walking around with a walker, and he was really scared and cried. And, there's a lot of hands-on parenting going on with those ages. And luckily I
Exactly.
had my husband, but he has a job. And so it was really hard to navigate all the logistics and the parenting part during the recovery.
Yeah, I mean, there's this pressure that you feel, at least this is how I felt with I have one child, and I got in a car accident when he was 2.5 on top of like the arthritis stuff. So it was also like a kind of acute injury on top of multiple, chronic things. And you have this urge, at least I do, to tell him, oh, it's gonna be okay, it's gonna be all better. But I also like, for me, sorry not to make this about me, but being like, I also don't want to give him like a false sense of like this
Right.
life includes problems that are solvable and problems that aren't. And like it includes things that get better and things that don't. Like, and I don't want to say that every owie always gets better because we know it doesn't, right?
Right.
Unfortunately, that is not how life goes for everyone. So it's just like, how do I keep my commitment to being honest? Like I'm so honest to a fault. I never even told him I never told him Santa was real. Like from a young age, I'm determined not to say that because to me that's a lying. That's a whole other thing. So I'm like, I'm not
Yeah.
gonna lie to him. I'll say that Santa's like a superhero. Some people believe he's real. I believe it's a character people dress up as. You can make up your own mind. So I'm like, I'm not gonna tell you that it's gonna get better. I can't lie to you. But I also
Right.
like want to say it's probably, I ended up saying it's probably going to get better. I think it's going to
Yeah.
get better. No one knows for
Yeah.
sure. I don't know. What do you?
I understand why you do that, and I do that to an extent too. I mean, my kids still believe in Santa, and I'm trying to. But my
No.
oldest is going to be pissed when he
And
finds
I'm
out.
not judge. I'm not judging
Oh, I
anyone else's
know.
choice. That's just my choice. Yeah.
No, 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 and I get it because you know what, my oldest Theo, he is very like logical, very black and white. Once he finds out, I'm surprised right now he's still. But we probably have one more Christmas where he's going to believe. Once he finds out, I'm scared that Theo's going to be so mad at us. He's like, you guys, and he's going to be like, you guys lied to me. So I get why you're doing
Yeah.
that. You want to build the trust so that
Yeah.
when something comes up, they can really trust that you know what you're saying. But hopefully, the Santa thing isn't going to do that. But I
I mean,
remember as
it's
a kid being
yeah, but
devastated.
it's the same thing. Like probably a better example related to chronic illness would be like, and this is just again, maybe this is like my little like soapbox, but um, when when the doctors tell kids it's not going to hurt, like,
Oh
and like
yeah.
you don't know whether it's going to hurt. Like I actually once did that to the dentist when they were saying to my son, it doesn't hurt. It doesn't. When he was getting the X-rays done, I was like, I'm sorry. He said it hurts. Like he doesn't lie. Like please honor the
Yeah.
fact. I didn't say please honor, but I said something like, I think it does hurt him because he's saying it hurts. He's never lied
Right.
before to us, like about
Good for
pain,
you.
And I was just like, please don't tell him it doesn't hurt when he's saying it does. Like you're telling him that like, what does it tell children if we say that you don't know your body? You don't know
Right.
what hurts and doesn't?
Right.
So
It's dismissive.
I don't know. Sorry. I'm like refraining
No,
myself.
I get it. I get
But
it. And yeah, yeah, no, I get it. I think that's awesome that you are so open with him about it.
but in your case, like when I had my car accident, there was a standard process of it hurts a lot at the beginning and then your body recovers. It gets better. That with an acute illness or acute injury that happens, and with a hip replacement, hip replacement surgery, there is a typical progression, right?
Hmm.
Hurts a lot at first, and then you get better and
Hmm.
better and better. And obviously, as evidenced by you now, 2 years down the line, running and doing all sorts of
Right.
things, it did get better. So that it is
Right.
true that it gets better sometimes. At first you were saying back to your story, back to you, that your kids were like, it's so true that kids are like freaked out by like medical
Right.
stuff, sometimes like equipment or bandages or whatever. And they do habituate to it, though. I will say most of the time they do habituate or get used to it over time, just throwing it out there. But like, there's lots of people out there who are, power wheelchair users who have little kids. And yeah, at first the kids are just like interested and intrigued and confused. And then they're like, oh, it's no big deal. But what was your recovery process like from the
Yeah. So
replacement?
the first one was in November. The second one was in April, 5 months, less than five
Okay.
months later. But just to add a little funny side note about that, my daughter, the 4-year-old, once they got used to it, my daughter thought my walker was the coolest thing. Theo's more
Exactly.
sensitive. They
Yeah.
called it the bad guy car. So they would like to push it around and pretend like it was a car, like a bad guy's car. I don't know.
That's
I
so
just
cute.
remember that randomly. What was my recovery like? I mean, it was the first one was great. basically the doctor told me for a hip replacement, the full recovery is 18 months to 2 years for your body to completely heal
Oh.
inflammation, because basically that prosthetic has to fuse to your bone, the
Mm.
metal. But I was feeling better after what, 6 months. I was pretty much in the clear.
Wow.
But you have a protocol, like for the first 6 weeks, there's you have restrictions, like the way you sleep, you can't bend in certain angles, because what
Yeah.
you risk is it going out of socket. And that's a
Hmm.
bad thing. So it's really painful. You have really strict restrictions or restrictions the first 6 weeks. And I had the posterior method, which is a little bit of a longer recovery than the other method that goes through
Yeah.
the front. And then after 12 weeks, so once you get to 6 weeks, you can sleep on your side, on your stomach. You have some restrictions are lifted, but once you get to 12 weeks, then you can start jogging, he told me. And I'm still doing PT. And then once you get to 6 months, he said I could, because he knew my goals, what my ultimate goals were, to train again for a marathon, not, go play on the floor with my kids necessarily. That too, but you know what I
Of
mean.
course you want. Yeah.
Yeah. So
Yeah.
6 months, he said, okay, we did our checkup again. He took the x-rays and he was like, all right, now you can start, training a little bit harder, because he said, the first 6 months, it's really crucial for the prosthetic joint to fuse to the bone, because they
Mm.
basically cut your femur and then it's a construction zone. They drill the titanium stem into your femur. So it all has to fuse together.
Yeah.
And you don't want to compromise that healing and that fusion.
No, you
So
don't want to
recovery,
rush the healing.
yeah,
Yeah.
recovery was hard because I'm a mom with two kids, and my husband has like a really demanding job where he doesn't get to work from home, and we don't have family here. So it was really hard being able to take care of those responsibilities. When I had my mom here for the first week, it was kind of nice. I was like, this is kind of great. I get to hang out here. I'm like, watch my movies. It was
Yeah.
painful, but I was like, I'm kind of taking it as like a little vacation, kind of like when you're in labor for the day or
Oof.
so before you go into labor. I'm like, this is great, man. Nobody's bothering me. I
You're
can just.
so tough. I love it.
So anyway, but yeah, the hardest part was just navigating it with the kids. And yeah, there was a lot of pain, but the second time I had it done, so fast forward
Hmm.
5 months, um, when I had the second one done, I had a more complicated recovery because the hip flexor tendon, um, just that's also, I found out, can happen after hip surgeries. The nurse described it as the tendon got pissed off, and so it
Oh.
was tightened and like it had tendonitis, and I was in so much pain. It was
Oh.
to get out of bed or anything. And so, because it felt like my whole leg was spasming, my husband would have to carry me.
Oh my
And
goodness.
it was extremely pain, like crying. I thought something was broken with the hip replacement. I remember one night calling the emergency helpline at the hospital and being like, something's wrong. Do I need to come in? Like, I am in so much pain, like crying, and my doctor called me and he said, I'm looking at your x-rays. I think it's the tendon. This can happen. So fast forward, I had a couple relapses with the tendon, but it still bothers me a little bit to this day, that tendon. But overall, like as far as pain goes, it's amazing. Like I don't
Wow.
have the pain aside from that little bit of that tendon pinching. But yeah, the recoveries were great. I mean, it was, I couldn't walk for 7 weeks.
Yeah. So
But
how
it's been right.
did you have home health, like home visits from PT and an OT to help you navigate any of this?
No,
What the
I stayed
hell?
in the hospital for 2 or 3 nights, and they did PT there and had the nurses come. But when I
Well,
got home,
see,
I stayed.
when both my parents had their hips replaced, they had home health, like, oh, sorry, home health nurse and then maybe physical therapist. So
Physical therapy, probably.
yeah, but I wonder whether because you're younger, they didn't think that you needed it. But it's just such a shame that you had to navigate this all on your own. That's one of my other soapboxes because I'm like,
Yeah, that
OT
was the
could,
hardest part.
yeah,
Yeah, well, so I stayed. Usually, people don't stay in the hospital as long as
yeah.
I did. Wasn't long. It was a few nights, but I think it was a blessing. My oxygen and my blood pressure dropped a lot, and my oxygen, and so I was fine with it. I'm like, I have these two kids at home. It's going to be chaos. I feel more comfortable being here at the hospital with the nurses
Hmm.
taking care of me before I go home to that situation. But yeah, I started PT. I want to say it maybe like 5 or 6 weeks.
Okay, okay.
I had to have somebody drive me.
Yeah, yeah.
because I couldn't drive for at least 6 weeks on the first one. On the second one, which was my right leg, which the one I drive with, I had to wait longer because if you slam on that brake or something with your hip, or if something happens, it's just you're at a little bit more of a risk for
Yeah.
affecting it, affecting the healing. So yeah, I would have to have
Yeah.
arranged drivers, or like for example, I would have to try to find somebody to take my son to school and take him home, things like
Hmm.
that. We ordered a lot of like DoorDash, or my husband works a pretty demanding job, but yeah, during the day I was kind of on my own, and I would have to get rides to the PT until I could start driving. But yeah, that was the hardest part those first 4 weeks, I would say, first 4 or 5.
Oh, it's just and how did you, you are obviously very mentally tough in that, you've anyone who puts themselves through multiple marathons is I would diagnose as mentally tough. But did like how did you mentioned how bad the pain was, like how did you cope with it? Like did you do breathing? Did you do visualize? Like how do you, or did you just kind of say just deal? Like I don't know.
I kind of it's a great analogy to running marathons, actually. Yeah, there were some I was in a lot of pain, but I kind of there's a quote that runners use, long distance runners, and it's like uh stay in the mile that you're in. Did I word that right?
Oh, I love
Stay
that.
in the mile you're in. So if you're in a lot of pain and you're doing like a 5 mile run, let's say, and at mile 3 you're thinking, oh my god, I can't make it, to mile 5. Stay in the mile you're in. Don't think about what's next. Finish that mile 3, just get to mile 4. So I related that helped me a lot mentally. Subconsciously, I used that tactic to help me navigate those first few weeks of my recovery. For example, to get out of bed to go to the bathroom was the hardest thing, because you
Oh,
can't move your knee in. If my knee went in a little bit, like with the hip, like trying to scoop
yeah.
myself using my arms out of bed, it would send like a shooting pain at my body. It's my body protecting me because it doesn't want to go out of socket. You don't want it to go
Yes,
out of socket.
yes.
So basically every step every day was like, okay, just this is the mile you're in, or I guess every 6 hours was the mile. Stay in this mile, get
Mhm.
through it, and day by day. And then it got into week by week, but mostly day by day. And that's how I did it. I tried not to think too far ahead and did what I was supposed to do or could do for the day that I was in.
But
And some days were way harder than others.
that's such a good analogy though, because I think like one thing that my therapist pointed out to me, because I didn't realize I had anxiety, I thought I was just really good at worrying. Like I'm
Me
good at
too.
and when I
I'm
worry
great
enough,
at it.
I stop bad things from happening. She's like, "Do you though?" And I'm like, no. Oh, but the thing is, it's like anxiety is always about all the things that could happen. It's about or mine is about the future, and so you're in moment, you're at 1 a.m. and you're in pain, you're trying to go to the bathroom, and you're like, well, how am I going to help my kids this morning? How am I going to do this? How am I going to do that? That's just causing more suffering versus
Right.
saying, what's my job? Sometimes that's kind of a mantra I say, like, what's my job right now? Like
Right.
it's kind of like a reorient yourself to the present moment. And we say things like mindfulness. Sometimes people think it sounds so like pie in the sky, like I'm peaceful,
Right.
mindful, meditating on a mountain. No, like
Right.
mindfulness is literally what you're saying, like being in the present
Right.
moment, right?
Yeah, and I kind of another quote too is I try to tell myself when I'm overwhelmed with just like everyday stuff is do the next best thing.
Yes.
Right? Stay in the mile that you're in. Don't get me wrong. I fail at doing this a lot, but
Yeah.
sometimes it works for me. A lot of times in this
Attempt.
hip,
Yeah.
right? Or like I was behind the scenes, even though I wasn't physically able. Like I couldn't. The kids would come down and visit me in the morning, but they had to be very gentle, because
Mhm.
if my leg moves in the wrong direction, it's very everything was healing, or very sensitive. There was a lot of trauma, but I still, being the mom, we're the moms and the type A. I was still like coordinating, even though I wasn't physically driving them. I was still coordinating and sending messages to my husband
Yeah.
or whoever, to friends, making sure they were taken care of. Clothes
Hmm.
were laid out, and it was. I felt like I still had to run the ship. I was just doing it from my bed
I love that. And
and
I
on
want
pain drugs.
yeah. Well, and I think it's many people who have young kids who end up getting a health condition, whether they had it, like I had, rheumatoid arthritis pre-pregnancy, or whether they get it after. A common thing I've heard parents say is that my child learned, like not to say toxic positivity, but my child learned some degree of empathy and compassion from seeing me need help. And it also kind of reinforce, or it can help them forge an identity of like, or in our family, we are helpful. Like, can you help me with
Right.
this? Like, it's not the parenting relationship. Like, there's a spectrum between like, I'm not gonna like saying that the child is becoming like parentified and that they're responsible for like,
Right.
taking care of the parent all the time. But like, we're human
Right.
beings in a social society, and like, they can help us sometimes too. It's not all about them.
Right.
So,
Right. And no, I think there was a good, I mean, there were a lot of positives that came out of it. I mean, that's a whole nother thing. I feel like I've said this before and I truly mean it, that as traumatic and depressing and all the lows and the trenches that my family and I went through before and during and after the surgeries, I feel like I've gained more than I've lost now that I'm on the other side.
mhm.
My kids, yeah, that was a little bit traumatic for them to see that. And, knowing their mom was hurting or was in the hospital, but I love that it motivates me too with my running, that they see me now overcoming that setback. And it's
Mhm.
a good lesson for them, that there are going to, whatever your setback is in life, maybe rheumatoid arthritis, it may be a hip replacement, a
Mhm.
broken leg, who knows, a learning disability, whatever that everybody's going to have something, you're going to have challenges in life. I like modeling that you can get to the other side and get through it.
Yeah. Yeah, that's true. That's true for things like this that have like a solution. Like
Right,
like that
right,
there's a
right,
surgery that works. There's like another skill to learn of like sometimes we try our hardest and our bodies aren't cooperating, and when we can find other ways to enjoy life. Like maybe I know some people listening, if maybe they have, let's say, like severe rheumatoid arthritis where it's just to the point where there just aren't any treatments that are working for them. And maybe even if you used to be a runner, there's a process where you like mourn the loss of that,
right,
but then discover something else. Like, this is the life we
right,
have. So what can we do? Maybe there's a new hobby,
right.
a new something else that brought you joy, like maybe singing or music or something. And that's also good for people to say, okay, well, we can pivot. But I'm curious.
Mhm.
I know people listening are going to be like, wait a minute. Okay, so we learned about the surgery. We know that we learned about the immediate, 6 weeks, 6 months. How did you get from then the 6 months post surgery to now where you're able to do these half marathons
Um,
again?
Slowly, I took it. I listened to my doctor and my PT. Yeah, so at 6 months, 6 months is the main clearance point, but keep in mind, 18 months to 2 years is the full
Yeah,
where, because I make the analogy, and maybe you can help me think of a better one. I'm like, your body basically is adjusting to two new siblings, your home, right?
yeah.
Because you got your old ones cut out. And so you'd be surprised, like, even though my hips now, I have these metal awesome hips, my feet and my shins your whole walking gait and running gait changes. So there were a lot of months where my shins would hurt or my feet or random aches because
Hey,
everything's changing your whole gait.
that's so true. I don't know how, I'm trying to remember what it felt like before I kind of learned all the complexities of human anatomy in my OT program. But yeah, it's like every single thing you do with your body from actually from before you're born, in the womb, like we're talking about with hip dysplasia,
Yeah.
yeah, breech babies, but let's say from when you're born onward, that your brain is developing a map of where your body parts are in space. That's called proprioception. Your vestibular system is figuring out your sense of balance, and it's also your brain, your motor cortex and your sensory cortex are developing a sense of like where your body part, what
Right.
happens when I do this, how much pressure do I apply. That's why babies are often like they're trying to reach for something and they overreach or they underreach. And then so you
Right.
have this lifetime, your brain has these like very highly developed maps of where your body parts are. And all of a sudden now you introduced this new thing. You're like,
Yeah.
oh, actually, and it doesn't have that metal part in your body, doesn't contain within it nerves, right?
Right.
And everything, the nerves and the everything around it are having to adjust and your brain has to make a new map in the same way that somebody with but yeah, prosthetic, you know, um,
Anything.
well, now prosthetics are become, there's like smart ones now that actually do communicate to your brain. But yeah, point being,
Oh, okay.
yes. Yeah, your brain had to remap your body in a way. That's kind of like the way
Yes.
I would see it. Your brain had to like reconnect to your body and
Right.
your muscles and tendons and joints, which had developed around not only your pre-surgery body, but the fact that you did have hip dysplasia, which is then quote unquote, like it's an abnormal, it's not the way the human body is ideally balanced, right? There's like a
Right.
balance that has evolved over time as humans went from like quadruped, to like bipedal people. And so
Right.
your body had compensated and adapted for the old way, and now it has to develop a new way. And so, yeah, I don't,
Right. Like
honestly, I didn't
yeah.
think about, that's me not thinking about it,
Well,
how that would
yeah, like
affect your running. Yeah, of course it did. Yeah.
so my lower back issue since I was a kid, that would looking back, that maybe I had some lower back issues, but looking back now, it's like, oh, that was because it was compensating. My back had to take over because my hips didn't work right, and so I did still have back, everything still had to adjust after the surgeries, and there was pain in a lot of areas. And that you have to be, yeah, but now fast forward, I'll go back to, how I am where I am now, but my lower back pain, I mean, I still have some, but it's essentially like gone. I don't want to say gone completely, but pretty much gone, because
Mm.
now that I've strengthened everything and I have these hips that are working, it took the pressure off my back. The other
Wow.
muscles and joints are working correctly. So it's amazing. And it's one of those things where it's not like it happened overnight, like severe back
Yeah.
pain. It happened gradually. So it's kind of, I step back and I'm like, wait, I haven't had back pain in a while. It's because my joints and my muscles, or my hips, are good now. I mean, they're strong, and I've built up
Right.
all the muscles around it. So now my back is okay. It's just not like it was, overnight. It's not like you can it's not like you can see it right away.
Mm-hmm.
It's
Mm-hmm.
something I look back on. I'm like, oh, my back pain's not there anymore. So yeah, I followed all the protocols. I was in, communication with my PT and my doctor. Um, and yeah, I was very conservative in how I started training again. I started with walk running,
Wait,
and
what's walk
slowly.
running? Oh,
Okay, so walk running. So basically, instead of just going straight to running, I was on a strict program. So this works for anybody who, if you want to start running, walk for 4 minutes, jog for 1 minute, repeat that a few
yeah.
times.
Yeah.
Then in a couple weeks or a week, do walk for jog for 2 minutes, walk for 4 minutes. And kind of
Mm.
slowly build up. So because I couldn't just start from zero to hero, because all of my, like we were talking about, my joints and everything, and my
Yeah.
bones and muscles weren't used to it, the pounding, and how, my gait was off. My gait was totally different.
Mm-hmm.
So I had to start very slowly building up to that, to walk running, and then, slowly, just one step at a time, then, distance and speed work eventually. And I'm, the whole time for the last 18 months, I've just been also like learning how to trust my body again, because I've been
Wow.
scared, a little scared at times to push it. So yeah,
Yeah.
I followed everything I was supposed to do. I got, aside from the second hip, like I had a really good, strong recovery. It was painful, but great recovery, no regrets. I still have a little bit of pain in my right hip flexor, but it's manageable. And I learned a lot from my PT. I try to get massages, every 6 weeks or so,
Yeah.
take
Yeah.
care of myself. And yeah, just if, try to be conservative with my training, as far as more days off, not running lower mileage. Like I said, I'm trying to figure out what my body can take, and I'm
Mm-hmm.
not, I don't want to push it. I'm a little bit scared still on
Yeah.
how hard to push it.
Yeah, yeah. That's understandable. I mean, I don't know. Like, that my next question was going to be about your doctor. Like, the surgeon, do they have many other case
No,
examples to pull from, right? So yeah, they're like, medicine typically is very like better safe than sorry. Like, they don't want to tell you, oh, go run a marathon
right,
if they don't like, but someone has, if they don't have that proof, quote unquote, from someone else doing it. But if no one's done it yet, that doesn't mean that no one can do it potentially, right? Safely. It just
right,
means that no one's done it. So maybe
right,
you're going to become the example that changes the practice potentially.
right. Well, he did say he's done like 6 or 7 thousand of these surgeries.
Oh my
He
God.
did say, right. He's
Oh my
amazing.
God.
Yeah, he's crazy. He's amazing. He's incredible.
I
Like
can't even
he's
comprehend that.
right. And he did say he's had three run half or fulls, but nobody ever run Boston. And Boston's the one that's like that's like the Super Bowl for runners.
Yeah.
That's
Yeah.
in April. And he had a basketball. That was, I needed to hear these stories to give me the confidence and to back up what he was saying, that I could run again. I'm like, why do you think this if the other doctors are saying no? And I did end up going back to one of the other surgeons who's great, that I saw before, Dr. Stocks. And that doctor had
Mhm.
told me no running with your hip replacements, because they just don't have enough information and data. He said, like we were just talking about
Yeah.
how it runners, and if it'll wear out the prosthetics a lot sooner. So
Mm.
my doctor, the technology's gotten a lot better, but my doctor, Dr. Stocks, And I had the conversation, if he thinks that they just don't have enough information, but he was like, are you willing to take on the risk? So I was like 41. And let's say hypothetically, they really don't know. Let's say these hip replacements last you 30 years. Are
Mm.
you, or 35? So that would put me at what, 70, 75. Are
Yeah.
you willing to take the chance that there's a chance if you're running long distance, it might wear them out sooner? They don't know. Are you willing to have 20 or 25 years instead of 30 or 35 before you need to get a revision and get it again? Absolutely.
Yeah. Yeah.
Tomorrow's not guaranteed. I'd rather get 20, 25 years of my life, do what I love, run again, get this. Who knows what they'll have then? So that's the way I
Exactly.
view it. And who knows if I'll even need it. I'm assuming I will because I got it done at a young age, but I'm fine with that. I'll be in my 70s. Like I want to live these years with my kids. I really want to. I feel like I have unfinished business with the marathons. It's
Hmm.
something that brings me. It's just a part of my soul. I feel like
Yeah.
I got a second chance at life again, getting this back after it was stolen from me. So yeah, there is a risk that I will wear down the prosthetic joints. And I think that's why a lot of doctors are scared to give the
Mhm.
green light to their patients. I've actually had, through my social media, through Instagram, a lot of people message me around the world who are going through this surgery or who might get it and asking me, how are you doing this? My doctor told me I couldn't, or you're giving me hope right now that I'm going to be okay and I can do. They ask me, so I'm so glad that I can
Mhm.
be. That's the best thing that's come out of it. Well, aside that I can run again, let's not lie about that. But that's the
Yeah.
second best thing that's come out of it, is that I feel like I can be that person that I was searching for all those late nights in
Yeah.
bed,
Oh my God,
and
that's so
give people that
beautiful.
hope. And I always say, this is what I'm doing. I'm glad I can give you hope. Like, your life's not over,
Yeah.
but you need to run this by your doctor. I don't want to get
Yes.
sued.
The conditions, and I think
Yeah.
that's very ethical of you. And that is like, I think I spend a lot of time thinking about, the promise and the perils of social media. And we have to just take both side by side. And one of the downsides if is people overgeneralizing, looking at one person's story and overgeneralizing that, assuming that what happened to X person is going to happen to me. And our bodies are different. The conditions are different, right? Your hip
Hmm.
dysplasia affected your body the way it did due to many factors, not just that it was hip dysplasia, but just your height, your genetics, your
Hmm.
weight, your activities. Someone else, even at 41, like same gender, same age, their conditions might be very different. Their body shape might be different, their activity levels. So sorry, this is just like a long
Right.
story, but
Right.
you're
No.
so right to say, like, but it helps a patient to know, looking like it just helps to know that even though I'm Carrie's not guaranteeing it will happen to me, it has happened with one person. Like, she has run
Right.
a marathon, like that's
Or I
amazing.
haven't run a full yet. I've done
Or a
half, but I have
half.
my full. But whatever. Like, that
To
I'm
me,
running
I'm like,
again.
it's in the category like a half, but that's true. Like,
Right.
yeah,
I'm right. And they also, it also depends on your recovery. Like I said, my second one was different. And your doctor and the way that they did it. Like, I mean, I don't know your doctor's technique, or like the
yeah,
prosthetic joints that they use. There's so much at play here. Kind of like I made the analogy to somebody on social media who was asking about running and what my plan was. I said, look, when you're pregnant, most if you're not a runner, you don't go start running again.
right,
Kind of like
right.
the same with the hip replacement. Most doctors now, including my OBGYN when I was pregnant, said, Carrie, you can go run, do what you were doing before you were pregnant. But if you haven't been a runner, that's probably not the ideal time when you're pregnant to
Yeah,
go start running. Same
yeah,
with hip replacements. Like, not saying you can't, I'm not saying you can't go run again after hip replacements, but it might be a while. My body
yeah.
had muscle memory from it. So that's why I maybe was able to do it a little bit sooner than other people might be able to. Because I had that experience. It was not like I'm going, like we said, from zero to hero.
Yeah, yeah. No, you said Zero to Hero. I love that. That's what the
Yeah.
movie, the
Yeah.
Hercules movie, Zero to
Is that
Hero.
where it's from? I just love
Yeah.
that quote. I didn't know where
Zero
it
to
was from.
hero and no
Uh,
turning back.
okay,
Yeah.
you're gonna have to link that. Okay, link that. I need to hear
Yeah.
that now. But yeah,
It's a,
no,
yeah.
yeah.
That's so
I was gonna
great.
say too, though, that like people that have messaged, one lady, you'll just find this interesting. Like, one lady these are from all over the world. This one lady, I think she might be in Afghanistan. I can't remember now. She's over on the other side of the world, and she was like really down. She was like, my doctor told me I can't even like sit down or lay on the beach or I can't sit in the bathtub with my hip replacements. And I'm like, wait, are
Forever?
you in the
Oh,
yeah, and I go, are you in like the initial 6 weeks, like with the restrictions? Because yeah, you can't like move in certain angles while it's healing. No, he said forever. I'm like, um, why? Like I didn't want to make her feel bad. And so
yeah.
I was like, well, I'm confused why. And I just don't know if some of doctors and other, every doctor maybe has
Yeah.
different
Yeah.
training, don't aren't as informed with the newest research, or I don't know what kind of hip replacement or joint, brand
Yeah.
she has, but I just thought that was interesting. And then I have other people who said this one man in England who's awesome. We text a lot. We message each other a lot.
Yeah.
We cheered for each other. He said he started running again, slowly, like a couple miles, and he started having severe, I think it was Achilles or shin splints. So he had to stop again. Going back to what we said, your body, even though your hips may be feeling fine, your body's still recovering everything.
Yeah. Yeah. Well, I mean, it's so important to have, I love that you've mentioned the word stories a lot throughout this. Like that I think that my brain is always keying in on key themes. And that's something I didn't anticipate, honestly, even being as powerful as it has been, sharing people's stories on this podcast, because it's so true that like it's such a fundamental need as humans to connect to others and to
Mm-hmm.
hear stories, see examples of people living the life that we want, and so I think it's what you're doing and what you're sharing is really important,
Well,
um
thanks. I think so too. And I think even if they can't end up doing whatever their goal is all the way right away, I think it's so important. And I didn't have a strong sense of hope because everything was so uncertain, and I didn't have
Mm.
somebody to look at.
Wow,
But I
yeah.
think it helps a lot mentally for these other people I've been talking to, or who are going through, or who will be going through these surgeries, to
Hmm.
have that glimmer of hope and to see
Yeah.
somebody
Yeah.
thriving. Because I feel like going into surgery, it's so scary. To have that confidence and that hope, I just feel like that's such a powerful asset to have going under any surgery,
I
you
love it.
know?
Yep. Yep. 100%. There's so much interesting research on mindset and our
Absolutely.
mental well-being and how that affects our pain levels. But just time wise, we're both busy moms. And I know
Has it
I
already
want to,
been like an hour?
yeah, well, yeah, but we have a little, I think we have a little bit more,
Okay, okay, yeah,
just to
okay.
do some rapid fire questions. You gave so many great words of wisdom. I mean, I think, would you add anything in terms of giving away words of wisdom for someone newly diagnosed, either with hip dysplasia or like
Right.
osteoarthritis? I loved your thought of, stay in the mile you're in. Is there anything else you would say?
Yeah. So my main pieces of advice are, if you're having hip pain, do your research, find not
Mhm.
only one doctor, interview a few, um, ask questions, bring in your questions. Then, if you do proceed with whatever your plan is, if you want to try
Mhm.
PT, find your care team. Find your surgeon, your doctor, your PT, your support team, friends, family. If and when you're ready, like I was, to go through with a hip replacement or a joint replacement, like I said, interview your doctors and then make your plan, and ask a lot of questions. And yeah, go through it, have your plan, have your PT, have your whole care team ready, have your support team ready, and take it, like I said, a day and a week at a time. Stay in the mile, do your
Right.
PT. Don't get overwhelmed about, how am I going to be able to do this in 3 weeks? Stay in the day and the week that you're in, and just stick to those little goals.
I think that's so brilliant. I'm going to be saying that to myself too. Do you have, I mean, this is redundant potentially, but do you have another favorite mantra or inspirational saying?
I have a lot.
Yeah.
I had to research a lot for that. Like I wanted a lot for myself. The
Yeah.
setback the comeback is always greater than the setback.
Ooh, I love
I love
that.
that one. I think I posted that when I posted my first surgery picture. I thought that one was so powerful, and it was like, it's so much sweeter. The comeback is so much sweeter than the setback,
I love that.
and it makes everything, like, I was a runner, and I always, I never had some huge injury like this that I had to come back from. But now that I'm getting like my second chance, like it's the second chapter of my running life,
Mhm.
everything's just so special and meaningful. It's like getting something stolen from you, thinking you'll never get it back, and then you get it back again. It just makes every moment so much more special with these races, and like going to Boston. Everything is just magnified. And yeah, it feels like the biggest gift ever. And I would have taken it for granted more if I had not gone through this. And it's made me stronger.
1,000%. I really feel that way. I mean, my happy place is swing dancing, and
I
I do love,
know.
yeah. And so I love soccer too, and I just have, for many other reasons, I'm not playing right now, but I have been re-engaging with the swing community, swing dancing community, jazz dancing community lately, and this year, and it's so true. You said, even though I had rheumatoid arthritis when I started swing dancing, but it was really controlled with medication.
Right.
So physically, I wasn't feeling a lot of impacts. I was feeling the impacts in other ways, like financial and insurance and navigating
Right.
this or that,
Right.
job accommodations and stuff. But I still took my body I didn't realize I was taking my body for granted until then. I've been through a lot worse kind of body stuff in the last health things in the last 10 years, and that I'm now back to where I feel comfortable dancing again. And I literally wanted to cry, like going to like a live jazz band the other night and dancing with my husband, just
Awesome.
being like, I mean, I think COVID swirls in there too, where it's like
Right.
we kind of were shielding for a while. And so we were like, also like took things for granted in that sense too, like
Right.
prior to COVID. So I just so resonate with that, like that it truly makes you feel, when you've been through something really hard and you can't do the activity that you love, it makes it so much better when you're able to do it again.
Absolutely. And I was going to say, remember at Healthy Voices and a month ago at Princeton, you did your dance up there.
Yes,
It was fantastic. I
it was
loved it.
so fun. My
What was
little
that?
yellow basket. I'll have to put
Oh
that.
my God.
I still
You
haven't
have,
uploaded that. I just due to
okay.
disorganization. So
You have got to do that this week. You've
yes,
got
I
to
will.
post.
Okay.
That was amazing. That was amazing.
Thank you. Thank you.
Yeah.
And do you have a favorite arthritis gadget or tool in your toolbox?
Yeah, for the massaging, a lacrosse ball. I like to. That mine's a little bit different than y'all's. When
Yeah.
a lacrosse ball, I roll out like my calves and my glutes on that. Try to keep my muscles around my hips loose. A foam
Nice.
roller. These are more for running though.
But no,
Uh,
but a
yeah,
roller can help a lot with loosening up the tissues around
right. I'd
too.
be happy to ever do a video with you and show some people, with rheumatoid or osteoarthritis, some activities or some physical like things with the foam roller, or like getting some of loosening mobility
Yeah.
exercises and
Yeah.
fascia release techniques. But
Oh,
yeah, that helps a lot.
that is
The
so cool.
mobility and the foam roller and the lacrosse ball massages, like I said, and staying hydrated.
Oh my gosh.
I
Yeah.
think that for all of us, right? Rheumatoid,
Mhm.
everything. I've electrolytes and water. I need to do a better job about it. I got these big old cups that I put the water in, and I've been using a new electrolyte powder that I love called Element, and I
Oh,
love it.
okay. I use liquid IV, but I know it's just like a lot of
Oh
sugar. Yeah.
no, but I love the pina colada liquid IV too.
Yes. Yeah.
But you got to try the watermelon Element and just staying hydrated. I think that, in getting enough sleep. Like, I don't have anything necessarily physical. Mine is taking care of yourself.
Yeah.
The physical things are the foam roller and the lacrosse ball massages, but drinking
Yeah.
your water, getting your sleep, working on your mental health, you
Yes.
know.
Yeah. I love that. Same, same, same. Do you have a favorite book or movie or show you have watched recently?
Okay, yes. So show Schitt's Creek. Uh
Yes. I'm still
and I
finishing it.
Oh, I love it so much. Okay. Podcast, love podcasts, running podcasts, but I've actually let's see, I have a couple running podcasts I listen to. And Brene Brown, I like listening to her. And
Yeah.
then for books, I actually, through all of this hip stuff, this my story got set up with an Olympic athlete, Meb Keflezighi. He's my
Oh,
coach. So I'm running. I got a golden ticket to Boston. I say golden ticket like jokingly. The hip company was able to get me I'm fortunate, they were able to get me a ticket to a bid for Boston in April. So I'm going to be running the Boston Marathon. Yeah, and they found out about my story, and so it'll be super special and emotional. You'll have to track me, but
oh, I
Meb,
will. 100%.
it will have, so yeah,
We'll have a watch
absolutely.
party.
Oh, I would love it. And so, long story short, Meb Keflezighi, he's amazing. He won the Boston Marathon in 2014, which was the year after the terrorist bombings.
Oh my God.
And he's in second. He got a silver in the Olympics. He's a marathon runner, just an all around stand up guy. You should look him up, Meb Keflezighi, put him in the show notes. But he
Yeah.
has a
Yeah.
book. I actually have it right here. I listened to the audio. Meb for more. Oh no, not this one. Run to Overcome. This is his other book, Meb for Mortals. Run to Overcome.
Okay.
By
Okay.
Meb Keflezighi and David. I'm listening to David Goggins' book. What is it called? Can't Hurt Me.
Oh,
A lot
wow.
of
I don't
mental.
know any.
David Goggins is intense, but he has a great story.
Wow.
I'm, on the first book, Can't Hurt Me. And Meb Keflezighi, that's my coach now. He's going to be getting me to Boston. So he'll be
That
there with,
is so cool. I'm sorry.
I
I'm
know,
so excited.
you got to follow him. He's amazing. He's just a stand-up guy. Yeah. And I got chosen, I got interviewed, and it's all like I said, some good things, some silver linings came out of these hips. And he's one of them. And I got the gift of him, being by my side as I make it back there. And so he'll be there when I cross the finish line. It'll be awesome.
That is so special. I cannot wait. Okay. Last one. How do you thrive with, well, now you kind of have corrected it, his dysplasia and osteoarthritis?
How do you thrive? Mentally, like we said, stay in the mile, do your research, don't give up hope. You can try it, go to PT, go interview doctors, ask all your questions. And when you're ready, and if you have to have a surgery, like I said, come up with your care, control what you can control. Ask your questions, find your doctor you're comfortable with, put together your care team and your support team, and take it day at a time. Do the best that you can every day. The little challenges that you have, make it to that, get through every day. So that's how you thrive. And then it's compounding, one day turns into a week, turns into another week, then a month. And here we are 18 months later, and I'm training for the marathon.
That's it. That's so, I love it. I love it. It really is. I think that control what you can and accept the rest, that like kind of serenity prayer, that seems to be kind of a theme in all these interviews and episodes I've done. I think it's you can't hear it enough times. You know what I mean?
Well, yeah. And I just want to say I'm not perfect at that. Like when I was going through all of this, I'm on the other side now. So, but when I was going through this, it was a couple of years, 2 or 3 years of going through the early stages, being in it and the uncertainty, and then getting out of it and the recovery. This truly tested me and my faith and my family. We went through a lot. So it's not like it's like, do this and you'll be fine. I mean, you are going to go through some hard times. That's part of the journey. But, just know that the good days are around the corner.
I love that. And you mentioned a few times your social media. Where can people find you online?
Okay, so I am on Instagram, and my little name my name is Carrie Bradshaw, but my Instagram handle is Bionic Runner Babe.
Yes, I love it. It's very memorable, so it's perfect. Yeah.
Yeah, and I'm sort of sharing my journey. I'm figuring it all out. I wasn't really big on social media until I started making my comeback, so I'm figuring it all out. And basically, I'm just sort of sharing my journey as I, the ups and the downs as I get back to with my training and getting back to Boston and life.
No, you're amazing. Thank you so much. Thank you.
Thank you, Cheryl, for having me. I loved meeting you at Healthy Voices. You were just such a breath of fresh air.
Oh, it was like we were like kindred spirits immediately.
We are.
Just like Anne of Green Gables and Diane.
Yes, in our little video. I love our videos. Yes.
Yeah.
Awesome.
Oh yeah, I'll put those in the show notes too. If you see me looking down, I'm always just like adding things to the show notes as we're talking. So I do
think we need to say that like at Healthy Voice. So we were at this Healthy Voice. I don't know if you've talked about it a lot. Yeah. We were at the Healthy Voices conference in Princeton, for your listeners, with Johnson & Johnson, where they brought together health advocates from all over
it was amazing.
The world and different areas, from diabetes, cancer, heart, arthritis, and they were all laughing. I mean, Cheryl Crow and Carrie Bradshaw were famous there.
I know.
They were like, there's a Cheryl Crow and a Carrie Bradshaw at our conference. So we got together and put together these little fun reels, and we just connected right away. It was fun.
Yeah. I'm so happy to have met you. And again, one of these silver linings of, having chronic illnesses, meeting other people who redefining what thriving looks like,
Right.
Yeah. So awesome.
Yeah,
well, thank you so much.
Awesome.
Hopefully everyone will follow you, and maybe we'll do another episode after Boston.
I would love to. And if you ever need any advice, or any of your followers do about, getting through some tips to manage the pain, let me know.
Awesome. You're awesome. Okay. Well, we'll talk to you later. Bye for now.
Okay. Bye, Cheryl Crow.
Bye, Carrie Bradshaw. Thank you so much for listening to another episode of the Arthritis Life podcast. This episode is brought to you by Room to Thrive, an educational program I created from scratch to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded course on your own, or you can take the course along with a support group. Learn more at the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I would be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also wanted to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on my website, www.myarthritislife.net. If you have any ideas for future episodes, or if you want to share your story or wisdom on the podcast, just shoot me an email at info@myarthritislife.net. I can't wait to hear from you.